UHUK is a partnership of urgent and integrated healthcare social enterprise providers who between them cover around 2/3 of the UK's population. These providers of NHS services don't always get the same recognition as other areas of the health and care system, but they are just as vital to the people who use them and to the functioning of the NHS as a whole. They work closely with local NHS partners and each other to coordinate care for patients, providing services around the clock, every day of the year, at home and in the community. This frees up A&E, ambulances and GPs for those in greatest need. In the Midlands, DHU Healthcare's dedicated team of more than 3,500 health advisors, doctors, nurses and allied health professionals experience high demand as winter approaches.
Good morning, you're through to the NHS 111 service.
Last year, DHU helped avoid more than 200,000 ambulance journeys and 50,000 unnecessary A&E attendances. Its 111 service took 3.5 million calls, triaging patients and directing them to the most appropriate urgent care and advice. By treating and caring for people in community-based services, DHU prevented non-essential hospital admissions. Results like these are being achieved by members across the country. It's a huge weight lifted off health and care systems that increasingly find themselves under significant strain.
We help patients navigate health services from the moment they reach us. We get them the right care at the right time in the right place.
100 miles away in Blackpool, Roland has been receiving treatment and monitoring for a serious respiratory condition from the comfort of his home. 400 local patients have been cared for by FCMS through specialist virtual wards and remote monitoring using state-of-the-art technology. Without this service, these patients would need to be cared for in hospital, but through the programme, 95% have avoided hospital admission. Virtual wards are an innovation that became vital in supporting COVID-19 patients through the pandemic and are an example of the sector's ability to respond to healthcare challenges at pace and scale.
They're on the ball, they're just there, and it's perfect for me.
Palliative care services support patients to live as well as possible towards the end of their lives. In Shropshire and Powys, teams from ShropDoc visit patients in their home when their GPs are closed all night, on weekends and bank holidays. Working closely with the local hospice and primary care colleagues, the palliative care team sees over 4,000 patients a year as part of a service that allows people to die at home with dignity, surrounded by their loved ones. This type of service supports people right across the UK.
I promised my dad I'd do everything I could to help him stay with us at the end of life. I didn't know how I was going to do it, but the services were absolutely amazing, and thanks to them I was able to give him his last wish.
Outside of frontline operations, UHUK members come together to share ideas, experiences and knowledge to build their collective capability. They recently pioneered an innovation programme in partnership with Warwick University, delivering prototypes that could soon help solve some of the sector's significant challenges.
Urgent and integrated healthcare providers are vital to addressing the challenges that are facing the NHS currently. We work together to make a real difference by avoiding unnecessary ambulance call-outs, by helping patients to avoid being admitted to hospital, and by supporting GPs by reducing the pressure on their practices. UHUK members are leading the implementation of local urgent and integrated healthcare services. We want to work collaboratively with policymakers, commissioners and our provider colleagues to shape the future of the NHS and make a real difference going forward.